Hi there, today we'll be doing a presentation on Alzheimer's disease. My name is Jasmine Delijani.
I'm Madison Totushek.
I'm Judith Angulo.
I'm Madeline Adams.
And I'm Ciera Georgi.
Okay, so Alzheimer's disease is a neurocognitive disorder that involves a change in memory and cognitive functions. Just like the rest of our bodies, our brains change as we age. Most of us eventually notice some slowed thinking and occasional problems with memory and remembering certain things. However, serious memory loss, confusion, and other major changes in the way our minds work may be a sign that brain cells are failing. So, memory is a process by which information is encoded, stored, and later retrieved. Cognition is a process by which information is reduced, elaborated, transformed, and used. When a person begins to exhibit signs of Alzheimer's disease, and as the disease advances through the brain, both memory and cognition is affected in a way that is abnormal with aging. Dementia is a general term for a disease that causes memory loss and impairment of cognitive abilities that interferes with daily life. Dementia can be caused by any disorder that permanently damages large association areas of the cerebral hemisphere or subcortical areas serving memory and cognition. Alzheimer's is a type of dementia that causes problems with memory, thinking, and behavior. Alzheimer's disease is also the most common form of dementia. This devastating disorder affects more than 5.2 million Americans and is the sixth leading cause of death. The risk for development of Alzheimer's disease increases with age. For instance, 4% of persons under age 65 years of age are at risk, 13% of persons 65 to 74 years of age are at risk, 44% of persons 75 to 84 years, and 38% of persons aged 85 years or older. The pathology of Alzheimer's disease. So Alzheimer's disease presents with subtle memory loss followed by progressive dementia over several years. Alzheimer's disease is caused by the accumulation of a peptide, amyloid beta, in the brain, which initiates the morphological changes of this disease. This peptide is derived from a larger protein called amyloid precursor protein, or APP. Diagnostic imaging reveals widespread atrophy of the cerebral cortex. The major microscopic features of Alzheimer's disease includes 1. Neuritic senile plaques. This is clusters of degenerating nerve terminals arranged around a central amyloid core. 2. Neurofibrillary tangles, which are fibrous proteins found in the cytoplasm of abnormal neurons that wind around each other in a helical fashion. These tangles are resistant to chemical enzymatic breakdown and are persistent in the brain tissue. And third, small cerebral vessels also exhibit amyloid angiopathy because there's deposition of amyloid beta in vessel walls. The number and distribution of plaques and tangles, mostly found on the neocortex, amygdala, and hippocampus, contribute to the intellectual deterioration that occurs with Alzheimer's disease. Some genetic risk factors include APP gene, presenilin 1, presenilin 2, and apolipoprotein E or ApoE gene. Nearly all persons with Down syndrome or trisomy 21 will exhibit pathological features of Alzheimer's disease as they age. It is important to note the loss of memory and cognition is not a natural consequence of aging. Instead, signs and symptoms of decreased cognition, memory loss, and behavioral issues is most commonly an indication of dementia or Alzheimer's disease.
Manifestations include the hallmark symptoms, which are loss of short-term memory and denial of such memory loss, including disorientation, impaired abstract thinking, apraxia, which is characterized as motor disorder caused by damage to the brain, and changes in personality. Initial changes include short-term memory loss, which is often subtle and is usually reported by the caregiver and denied by the person. Other manifestations include randomly forgetting important and unimportant details, for example, having trouble remembering appointments. As the disease progresses, there are various stages. The first stage includes the moderate stage, which may last several years and is marked by a more global impairment of cognitive function. During this stage, the person becomes unable to live alone, may neglect hygiene, experience extreme disorientation, lacks the ability to perform ADLs, experiences changes in relationships, and may become depressed as a result of their awareness of these deficits. The second stage is severe Alzheimer's, which is the last stage of the disease and is characterized by a loss of ability to respond to the environment. During this stage, the person requires total care and spends most of their time bedridden. As a result of chronic debilitation, death can occur.
The diagnosis portion includes that there are no peripheral biomarkers, and it can only be confirmed by microscope examination of tissue obtained from cerebral biopsy or autopsy, and mental status tests such as mini mental state exam or blessed dementia tests. The onset is between 40 and 90 years of age, and during the diagnosis process, they must rule out other systemic or brain disorders that could be caused of memory or cognitive deficits. Brain scans such as MRI or CT scans rule out other possible brain diseases as well. Metabolic screening for B12 deficiency, thyroid dysfunction, and electrolyte imbalance. These are reversible causes of dementia.
So for treatment, there is no current curative drug therapy available. There are certain medications that can slow the progression of the disease and to control depression, agitation, and sleep disorders. The two goals of care for those who are suffering from Alzheimer's are maintaining the person's socialization and provide support for the family. There are certain medications that can help, and they're listed below.
So, in conclusion, Alzheimer's is the most common form of dementia, and the risk for development of Alzheimer's increases with age. Alzheimer's causes degeneration and atrophy of cerebral cortex, and this disease presents with subtle memory loss and progressive dementia. It is diagnosed by mental status tests and brain imaging, and there's currently no cure, and the progression of the disease can be slowed with medication. We've also included some slides that have NCLEX questions so you guys can practice.
Thank you for listening.
Thank you very much.